Okay, kiddos, we're making our way to the end of the semester here, and we're going to talk about pharmacology. Pharmacology, we're going to describe the various subspecialty areas of pharmacology, identify the various routes and schedule of drug administration, differentiate among the various classes of drugs and name their primary actions and side effects, define medical terms using combining forms, prefixes, and suffixes, and relate them to pharmacology, apply our knowledge to understanding medical terms. So very similar chapter goals, but let's talk about what drugs are. Drugs are medicines or substances used to prevent or treat a condition or disease, obtained from various sources, plants, for example, digitalis, animals, for example, hormones, or synthesized in the lab, for example, methotrexate. So there's a lot of things that we want to consider now. A lot of times, is caffeine considered a drug? Right? So some people would say, yes, caffeine is a drug because it's highly addictive. So a pharmacist is a PharmD. A pharmacologist is either a MD or a PhD. Subspecialties include medicinal chemistry, synthesize new drugs, molecular pharmacology, where they study the interaction of drugs and subcellular substances, chemotherapy, drugs that destroy microorganisms, parasites, malignants, toxicology, harmful effects of drugs, and antidotes. So in the US, only an MD or DO can prescribe medication. Okay, so a PharmD cannot prescribe medication for you. Okay, so only an MD. Other countries have different regulations, but in United States, it's usually a DO or a MD. Pharmacodynamics. Pharmacodynamics is the study of a drug's effects in the body, and pharmacokinetics is the study of a drug's absorption, distribution in the body, compartments, metabolism, and excretion over a period of time. Basically studying how does the body alter drugs, what does first pass mean, what sort of things might professionals who develop medicines have to consider. Right, so there's a lot of things, especially when they're developing the vaccine, there's a lot of things that they had to take into consideration as well. But which term means below the skin? That would be B. That would be subcutaneous. Okay. So the chemical name is the exact chemical makeup. The generic name is the legal and scientific name. And the brand name is trademark or drug manufacturer. So let's give Tylenol, for example. Okay, so the chemical name is acetaminophen. The generic name might be Tylenol. Okay. Or acetaminophen. I'm sorry, the brand name is Tylenol. The generic name is acetaminophen, and the chemical name would be the exact chemical makeup of that. All right, just to reiterate, the generic name is acetaminophen, the brand name would be Tylenol, and the chemical name would be like C8H9NO2 would be the chemical name. Okay, so another example would be Advil. Advil is the brand name. The generic name would be ibuprofen. Okay, so ibuprofen can be branded under a brand name such as Advil, Motrin, etc., etc. So knowing the difference between the generic and the brand name is important. Now, the FDA is the Food and Drug Administration. USP is the United States Pharmacopoeia. You have a hospital formulary, and then the PDR is the physician's desk reference, where you can look up all the side effects of every drug known to man, and or you can look up drugs.com, which is a great resource. So when you get a chance, check out drugs.com. You can type in multiple drugs and see the side effects of taking all of them together, which a lot of patients do, unfortunately, because they'll go to one doctor, they'll prescribe something, they'll tell them a side effect of another one, and then the doctor will prescribe something else, and before you know it, they're taking 10, 12 pills, and one physician is not talking to the other at times, and it's just a cascade of effects. Now, how can you take drugs? You can take them orally, sublingual, underneath the tongue, rectally, parenteral, intracavitary injection, intradermal injection, intramuscular injection, intrathecal injection, intravenous injection, subcutaneous injection, inhalation or topical. So there's lots of ways to administer the drugs. And now, what would be the benefit of taking one versus the other, orally versus sublingually versus rectally versus IVs, inhalation or topical? Well, the rate of administration would be a lot faster. So now, terminology of drug action. Receptor is the target of the drug. An action and interaction of drugs in the body, so a combination of true drugs. It can be an additive action, an antagonist, or a synergistic. Other actions of drugs, you can become tolerant or addicted. Means that the combination of true drugs is greater than the total effects of each drug by itself. So that would be synergism or potentiation. Okay, so two drugs working together would be beneficial. It's kind of like Vicodin is a good example. To give you an example of Vicodin, which would be the brand name, well, that's a combination of acetaminophen and hydrocodone. And hydrocodone is the opioid that people get addicted to. They don't get addicted to the acetaminophen part. That's the non-opioid part. Okay, so knowing that is very important, that certain drugs have certain combinations. Drug toxicity is unwanted and potentially dangerous effects of drugs. Idiosyncrasy, unexpected and uncommon, like anaphylaxis. Iatrogenic, produced by treatment. Side effects, routine, often tolerable, reversible when drug is discontinued. Contraindications, dangerous and ill-advised use. And resistance, lack of beneficial response. Alright, so just to kind of review here, we just want to make sure that we're all on the same page, because pharmacology can get a little overwhelming, so you want to make sure you know what molecular pharmacology is, interaction of drugs and subcellular structures such as DNA. Okay, know the difference between pharmacodynamics and pharmacokinetics. Know the term meaning below the skin, that's intravenous. Transdermal would be through the skin. Know the difference between the generic name and the brand name. Not so much the chemical name, that would be a chemistry class, but know the difference between a generic name and brand name. Know what parenteral means. That means giving a medication via injection. And injections would be intradermal, intramuscular, intrathecal, intravenous. So parenteral is delivering a drug via an injection. Inhalation would be like asthma medication, but using aerosols, and topical would be obviously just rubbing lotion like an analgesic on, such as Bengay would be topical. Okay. All right. So what are the classes of drugs? Well, you have lots of classes of drugs. You have analgesics, anesthetics, antibiotics, anticoagulants, anticonvulsants, antidepressants, antidiabetics, antihistamines, osteoporosis, cardiovascular, endocrine, GI, respiratory, sedative, stimulants, and tranquilizers. So, what are your cardiovascular drugs? Those are your angiotensins, angiotensin 2, antiarrhythmic, beta blockers, calcium, cholesterol lowering, and diuretics. So what you want to do when you're studying these is know the classes of drugs like cardiovascular and which ones fall under that. So under the cardiovascular drugs, you have the antiarrhythmics, the beta blockers, the diuretics. Okay. Under the endocrine drugs, you have estrogens, you have testosterone, glucosteroids, thyroid, selective estrogen receptor, progesterone, androgens. Okay. Under the GI drugs, you have antacids, anti-ulcers, antidiarrheal, cathartics, which are the laxatives or purgatives, anti-nauseants, antiemetics. So not only knowing the class, but what is anti-nauseants or antiemetics, what class is that under? Now, so addiction is a physical and psychological dependence on and craving for a drug. Additive action, drug action in which the combination of two similar drugs is equal to the sum of the effects of each other. Aerosol, particles of drugs suspended in air, such as like albuterol. Anaphylaxis, make sure you know what that is. That's exaggerated hypersensitivity reaction to a previously encountered drug or foreign protein. Antagonist action, combination of two drugs gives less than an additive effect. Antidote, agent given to counteract an unwanted effect of a drug. Brand name, commercial name for a drug, trademark, such as Tylenol. Chemical name, chemical formula for a drug, C6H9NO2. Contraindications, factors that prevent the use of a drug or treatment. Controlled substances, drugs that produce tolerance and dependence and have potential for abuse or addiction. Dependence, prolonged use of a drug that may lead to a physiological need for its action in the body. Dose, amount of drug administered. So know what the definition of dependence is. The FDA, you've heard about the FDA a lot recently because we're waiting for the vaccines to get approved for the coronavirus. The U.S. government agency with legal responsibility to enforce proper drug manufacture and clinical use. Generic name is the legal non-commercial name for a drug. That's acetaminophen. So that's the generic name. Iatrogenic, condition used by treatment given by physicians or medical personnel. Idiosyncratic reaction is an unexpected effect produced in particularly sensitive patients, not seen in most patients though. Inhalation, administer of drugs in gaseous or vapor form. Medicinal chemistry, study of new drug synthesis. Molecular pharmacology, study of interaction of drugs and their target molecules. Study DNA and their nucleotides. Oral administration, drugs are given by the mouth. Parenteral administration, so make sure you know what parenteral administration means. That means drugs are given by injection into the skin, muscles, or veins. Pharmacist, specialist in preparing and dispensing drugs. Pharmacy is a location for preparing and dispensing drugs. Pharmacodynamics, study of drug effects within the body. Pharmacokinetics, study of drug absorption, distribution, metabolism, excretion over a period of time. Pharmacologist, specialist in study of properties, uses, and side effects of drugs. Pharmacology, study of preparation, properties, uses, and side effects of drugs. Physician's desk reference, PDR, reference book that lists the drug products. Receptor, target substance with which a drug interacts in the body. Rectal administration, drugs are inserted through the anus into the rectum. Resistance, lack of beneficial response. Response, desired and beneficial effect of a drug. Schedule, exact timing and frequency of drug administration. Side effect, adverse reaction, usually minor, that routinely results from use of a drug. Sublingual administration, drugs are given by placement under the tongue. Synergism, combination of two drugs causes an effect that is greater than the sum of the individual effects of each drug alone. What's a syringe? Instrument for introducing or withdrawing fluids from the body. Tolerance. Larger and larger drug doses must be given to achieve the desired effect. So make sure you know what tolerance means. Topical application. Drugs are applied locally to the skin or mucous membranes. Toxicity. Harmful effects of a drug. If you guys know Vicks Vapor Rub, certain cultures will use Vicks Vapor Rub for everything. You got a headache, Vicks. If you got a cold, Vicks. If you got coronavirus, use Vicks. It should, and that's the topical application. What probably helps more is your mom or your grandma rubbing the actual Vicks on you. That's more soothing than the actual Vicks itself, but it does help because that menthol opens the airways. Toxicology, study of harmful chemicals and their effects on the body. Transport, movement of a drug across a cell membrane into the body cells. USP, authoritative list of drugs, formulas, and preparations that sets a standard for drug manufacturing and dispensing. And vitamins, substances found in foods and essential in small quantities for growth and good health. Okay, aero would be like aerosol, particles of drug. Analgesic, so sensitivity to pain, so analgesic pertaining to without sensitivity to pain. How about bronchial tube? Okay, like bronchitis, inflammation of the bronchial tube. Chem, drug, chemotherapy, treatment using drugs. Crass is a mixture, so idiosyncrasy, unexpected effect of a drug that's peculiar to an individual. Cutaneous skin, cutaneous, subcutaneous, pertaining to under the skin. Derm, skin, hypodermic, pertaining to under the skin. Work, so ergonomics. Esthés, feeling, okay, like anesthesia, condition of being without nerve sensation. So esthés, feeling of sensation. So an would be without feeling or, okay. His, tissue, so antihistamine, agent that acts against histamine production in the body, and histamine is released as a result of an allergic reaction. Hypno, slip, so hypnotic, pertaining to a condition of sleep. Iatra, which is treatment, so iatrogenic, pertaining to an adverse condition that's caused or produced by a physician or a special treatment. Lingual, so lingual, sublingual, underneath the tongue. Myco, mold and fungus, so erythromycin, antibiotic that's produced from a red mold. Narco, stupor, a narcotic, pertaining to a substance that produces stupor. Oral, mouth, so, and then pharmaco, drug, pharmacology. Pruit, itching, so pruritus. Antipyretic, pertaining to an agent that acts to relieve itching. But pyretic is fever, so antipyretic, which would be Tylenol, pertaining to an agent that acts to relieve fever. Thake is a sheet of the brain and spinal cord, so intrathecal, pertaining to within the sheet of the membranes, intrathecal. Tox, poison, toxic, toxicology, toxic, poison. Vaso is a vessel, so vasodilation, vasoconstriction. Van is vein, so intravenous, pertaining to within a vein. Vita is life, so vitamin, a substance foods as essential to life. Ana, meaning upward or excessive. Anaphylaxis, a hypersensitivity state of the body to a foreign protein, antigen, or drug. Anti is against. Antidote, an agent given to counteract an unwanted effect of a drug. Contra, against, opposite, so contraindication. Par, other than, part, so paraenteral, pertaining to injection of drugs other than through the intestines. Syn, together and with. So AC would mean before meals. ACE, angiotensin. Ad lib, freely as desired. APAP is the abbreviation for acetaminophen. ARB, angiotensin. BID, 2 times a day. C is with. CAPS is capsules. CC, cubic centimeter. FDA, U.S. Food and Drug Administration. GM is gram. GTT is drops. H is hour. H2, beta blocker. HRT, hormone replacement. IM, intramuscular. INH, isoniazid antituberculosis agent. So if you have TB, you would take that. IV, intravenous. MAIO, monoamine oxidase inhibitor. mg, milligram. ml, milliliter. NPO, nothing by mouth. NSAID, non-sterile anti-inflammatory drug. P is after. PCA, patient-controlled analgesics. PDR, physician test reference. PO, by mouth. PRN is needed. So knowing these abbreviations are very important because you're going to see these in the medical chart. So I would definitely spend some time with these. PT, patient. Q, every. QH, every hour. Q2H, every 2 hours. QID, 4 times a day. QS, sufficient quantity. QAM, every morning. QPM, every evening. RX, prescription. S, without. SERM, selective estrogen receptor modulator. SL, sublingual. SOS, if it is necessary. SSRI, selective serotonin reuptake inhibitor. SQ, subcutaneous. TAB is tablet. TCA, tricyclic antidepressant. TID, 3 times a day. Which term best prevents nausea and vomiting? That would be antiemetic. Okay, and just to end, here's some common drugs that you might be familiar with, such as Tylenol, which is acetaminophen, pain and fever reducer. It doesn't do anything for anti-inflammatory, so if you have inflammation, you would take Advil, which is the brand name, but the generic name is ibuprofen. Motrin is also ibuprofen. Morphine is a pain medication, strong pain medications, highly addictive. Amoxicillin, Cipro, those are all antibiotics. Heparin is a blood thinner. Albuterol is a bronchodilator used for asthmatics. Benadryl or Claritin are antihistamines. And then for topical analgesics, Icy Hot. So you've seen that. All right. Good luck.